Yeah, I think they're here already. I don't think there's any letting them in. Can somebody verify in the chat that you're here? Yay. Okay, welcome everybody. It's always tricky because the webinars just start with the attendees. I always forget about that. You don't let people in like you do with a meeting. Welcome. I'm so glad you're here. My name is Alexis Plus, and I'm the founder and executive director of Truth Farm, which is a grassroots community-based organization in Binghamton, New York, that I started after my family's experience and journey with substance use, primarily what propelled me into starting this organization was losing my oldest son, Jeff, to an overdose in 2014. We're easy to find. There's our contact information, but if you just Google Truth Farm, you'll be able to find us for sure. Somebody said there, okay, not an echo. And we would love for you all to put in the chat window who you are and where you're from. We, as the panelists, probably will not be able to keep up with the chat window during the presentation, but feel free to introduce yourselves to us that we'll read later and to your fellow attendees. That would be great. And I already introduced myself, and so I'll hand it off to Chelsea to introduce herself next.
Thanks, Alexis. My name is Chelsea Pickett. I use she, her pronouns. I am a PhD student at CUNY School of Public Health, as well as a research and evaluation professional. And I was the team lead on the project. And I will pass it to Ella.
Hi, everyone. I'm Ella Daly. I am currently an undergrad at Binghamton University in my senior year. And on the report, I did a lot of the research and I also helped with writing.
Hi, I'm Macy Johnson. I am a grad student at Binghamton University, and I helped with the data analysis and data visualization.
Awesome. And they also all help write and edit the report as well. So the report that we published in February 2026, there's a picture of the cover right there, Community Solutions, State Exclusions, the Misalignment of New York State's opioid settlement funds, is something that came about because we've been doing advocacy around the opioid settlement funds since they came to New York, and actually quite a bit before that. We have been advocating about holding Big Pharma responsible for their role in the overdose epidemic since our inception, so since 2015. And we've been heavily involved in the Purdue Pharma bankruptcy proceedings. In fact, there's some stuff coming up about that you should know about. I won't get into it here, but reach out if you're interested in getting involved with that. And here in New York State, we helped get a law passed in 2022 that made sure that the opioid settlement funds were going to go into what we call a lockbox, even though there's no real lockbox. Rob Kent would tell you that. In New York State, to make sure that the funds didn't go into the general fund. We helped get the law passed that said they went into a fund called the Opioid Settlement Fund, and it set up something called the Opioid Settlement Advisory Board in New York State. And we thought that everything was going to go swimmingly, and that the funds would be spent to turn the overdose epidemic around. Unfortunately, as time went on and we were attending the Opioid Settlement Advisory Board meetings, and we were also combing the RFAs as they came out, hoping that there would be some funding available to community-based organizations like ours, what we found was that was not the case. The RFAs that were released were in order to be eligible to even apply, you already needed to be a licensed provider. And so the funds were being pumped into the same exact system that wasn't doing all it needed to do to turn the overdose epidemic around. And so we started doing some advocacy. And last year, we really were not getting anywhere. And then last year, we wrote a list of amendments that we wanted to see passed that would change that law and how the funds were being distributed. And we still got no traction. And so I started doing some research myself, looking at where the funds exactly were going and what the size of the organizations were that were being funded. And I had kind of wrapped that research up, early last year, and then realized we really needed something to show legislators. And so I decided that we would write a report. Some of the interns who were helping me with the research, Ella was one, was still here with us, and she was helping me with the research. And so we just decided to create a report. Next slide, please. And what that report ended up showing is that what we suspected and what we were seeing very early on in our research was true, that funding was not getting to grassroots and small community-based organizations. The bulk of the funding was going to very large organizations who already had billing mechanisms, so their services are, for the most part, already reimbursable. They already had large cash reserves, which means their budgets were already sustainable. And I want to make clear always that it's not that it's a problem to fund these organizations. The problem is more about the proximity, which Chelsea will talk about later, to the community that we're serving. And making sure that we get these funds as close to the community as possible, where innovation usually takes place and where community-driven solutions come about. And if we keep doing the same thing over and over again, that's the definition of insanity. So if we keep funding the same things over and over again and we don't see measurable results or measurable impacts, we know that we're doing something wrong. And so we felt strongly that these opioid settlement funds should be spent to do something different, something new, something innovative, something that's community driven. And so that's where our report came about. Next slide, please. Since publishing that report, we have gotten a lot of questions from people who are curious about how we went about the research, how they could maybe do the same thing in their state or county, or maybe write a report about something different. And so that's why we decided to host this webinar. Truth Farm's all about empowering people to make a difference. And so if you're so inclined, today we'll walk you through a process to possibly write a report of your own. And we'll be looking at our report kind of very high level as well as we do that, so you can learn how we went about guiding our report. Next slide. And the first question to ask yourself is, why do you want to write a report? I suspect if some of you are here and you've been thinking about this, it's because you have already seen something that's frustrating you in your community, whether it's your state, your county, your city. Maybe you've struggled to access opioid settlement funds. Maybe you see them being spent on ridiculous things like fire trucks or policing, or what we call supplantation of funds, which means governments are scaling back what they normally spend money on in terms of the overdose epidemic and using opioid settlement funds to pay for those programs instead. That's called supplantation, which is against most of the rules of the opioid settlements themselves. But, based on what you're seeing already, what do you want to see done differently? What needs to be done differently? What's your goal? Our goal was making sure that these funds are being spent in a way to turn this overdose epidemic around and impact the community directly. So, really figure out, get to the heart of what's your goal and who's your audience going to be. Chelsea will talk a little bit about this in terms of our report, but your report might be for policymakers. Our report, we wanted to be accessible to community-based organizations and community level people, because those were the people that we were focusing on exclusively. Next slide. And our report, I forgot to grab a copy before I sat down. I think it's like 38 pages. Our report might look a little bit daunting to create, but I think that anyone can do it. As I mentioned, we're a small community-based organization. We have a budget of around $700,000, so we're pretty tiny. But I think it's one of those situations where you ask yourself, who do I know? What resources do I already have? And luckily, at Truth Farm, we're in a community, it's a university community. So Binghamton University is in our community. We have interns at Truth Farm as often as I can get them because I love them. But we always have 2 to 4 interns from Binghamton University at Truth Farm. And I discovered very early on that Ella was great at research. And so Ella, I recruited Ella to help us with the research. And Macy, I didn't know had this incredible skill of analyzing data. And so I invited them to be a part of the process of creating this report, which was just great. We had these resources right here in our office already in the form of interns. And then and I'm sure a lot of you also participate on a lot of coalitions and a lot of other organizations. And I met Chelsea Pickett through New York State Harm Reduction Association. Shout out to NYSRA. And Chelsea often at those meetings talks about the importance of having evidence, research and evidence to back up your advocacy work. And I heard Chelsea say it often enough that finally a light clicked off in my head and I was like, oh, I need Chelsea's help. And so I am overbooked like a lot of executive directors are. And so I pulled Chelsea in to be the lead for our project of writing this report. And she did an incredible job. And we paid her as a consultant and at a very reasonable rate. And so I think just ask yourself, we probably could have found a professor as well at Binghamton University who might have been interested. But I would just ask yourself, like, you don't have to do this alone, and you actually should not do it alone. I don't recommend writing a report like this by yourself because I think the more eyes and more hands, the better. It'll make the report stronger. But just ask yourself, who do you know? What resources do you already have? Who might be interested in helping you pull this off? And then connect with them. I'm sure that they would be glad to help. Next slide, and I'm going to hand it off to Ella to talk about the next part of the process.
Thank you, Alexis. So the first step when you're trying to understand the opioid settlement funds in your area is to understand how those funds are distributed. And distribution of funds can be complex. Each state varies in how they distribute their funds, with some states being similar and other states being very different. And so it's important to know which avenue of funding you are focusing on for your own mental clarity and to focus your research and eventual report. And in our case, as you can see on the diagram, we focused on the discretionary state abatement of the opioid settlement fund share, which makes up only 20% of the total New York State settlement funds. And that is highlighted in the yellowish color. And also, by looking into the specific flow of funds in your area, you may uncover more questionable aspects you may want to dive deeper into that you were not expecting to find. In our case, for example, upon reading certain New York State laws, we found that it is required by law for organizations that receive opioid settlement funds to annually certify that they are utilizing those funds in accordance with the requirements placed on them. And we found no such annual certifications exist, and we made sure to add this to our report. And to figure out the flow of funding in your area, you should look at publicly available websites and identify which government agencies or boards receive the funds and control them. And you should also look to your state laws, policies, and statutes to see if there are any restrictions or rules for how the funding should be spent. And drawing a flowchart like this one is very helpful to get your mind around it. And a few helpful tools for you to get started include the Opioid Settlement Fund Tracker website, the KFF Health News Payback, Tracking the Opioid Settlement Cash, and if you're in New York, the Legal Action Center New York State Opioid Settlement Watch. And so for our report, it took us a little bit of time to get our heads wrapped around the flow of the funding we were looking at. And so we created this primer. The QR code on the screen will take you to a link to it. And so as we researched the data to our report, we realized that there was no one source that really explained the flow of opioid settlement funds in New York State. So we decided to create one, and we attached it to our report, and it's titled The Opioid Settlement Funds in New York State, Background, Structure, and Oversight. And so when looking for the publicly available information about the opioid settlement funds, you should go to government and regulatory agency websites to find what resources are available. And in our case, in New York State, there's the Office of Addiction Services and Support Opioid Settlement Fund Tracker, which has the 20% of funds that we looked at documented. And then when you're looking at this information, you should document what is available and also make sure to document what information is not available. And keep in mind that not every state has these transparency requirements like New York State. And even if the states do have transparency requirements, they proclaim they're transparent, they may not actually be transparent, as in the case of New York State as well, as we found upon deeper investigation. And so if you find information that you are missing that you think you should be able to know, you should submit a FOIL request, which is a Freedom of Information Law request to the right agency. Each government agency has their own FOIL system for you to get publicly available information. And the FOIL law mandates that federal or state agencies disclose records upon request to ensure transparency, unless the information falls under a specific exemption, like personal privacy. And when you go to submit one of these FOILs, you should be clear in your language, express exactly what you are requesting, and the more specific you can be, the better. And in our case, for our research, as we were doing it, we came across gaps and thought of additional information that we wanted to know. So we submitted 3 FOILs throughout the process. And it may be different in your area, but I submitted these FOILs back in October of 2025, and I have yet to hear back from 2 of those. And I just received the answer to one of them last month. So it's important to keep in mind that if you get denied your request or there's a delay, like 5 to 6 months, as in our case, that violates statutory requirements, you can appeal and you should seek out legal help if needed. And so once you have all the information, once you know what information is available and what you want to look at, it's time to actually do the research. And in our case, we limited our research to just publicly available information. And this brought us to the New York State Office of Addiction Services and Support Opioid Settlement Fund Tracker, which I'm going to show you. But so this is what it looks like for New York State. The tracker, it splits it up into fiscal years, so starting with the most recent 2026, and we focused our research on this table, the fiscal year 2023 by date and initiative table. And it looks like this, and this is Oasis's idea of being transparent. They have the link to the RFA, which is what the organizations could apply to, who's eligible for that funding, and then kind of how they did so. And then the other part to this table is the actual organizations who were awarded, and that is under this number of awards tab or column, sorry. And it gives a little bit of a press release, and then it says what each organization got, which is $500,000 in this case, and then the list of organizations that receive funding. But for this website, not every link is the same. Each one has their kind of own way of distributing the information, which is really interesting and goes to a lack of transparency as it gets confusing for the everyday user. So back to the slides. And so on its face, it seems to be transparent, but they continue to update this table to today with new organizations that were awarded in 2023 being added now, which just kind of confuses the data a little bit. So it's important to make sure to scrutinize your areas that are have publicly available information. Don't inherently trust it. dig deeper and make sure it's right. And if there's any gaps in information, you can FOIL or piece it together somehow. And the next step in our case for our research was to find budget information for the organizations that were awarded. And so we looked at the publicly available 990s that can be found on ProPublica or the IRS nonprofit lookup. But depending on what you're looking into and what you want to know through your research, your system may be a little bit different. And so then once you have all the data, it's important to organize it and make sure you have a clear way of visualizing it while you're still collecting it. And we highly recommend making a spreadsheet, makes it lays everything out. It makes it easy to look at in different columns and rows. And the QR code on the screen right now takes you to the spreadsheet that we used in our report, and it organizes the information through each organization that was awarded, the initiative they were awarded under, and all their budget information. And so something like that can just help you understand your data as you're collecting it. And now I'm going to pass it off to Macy to talk about how to analyze data.
Perfect. So the next step in our process is to actually analyze the data to identify any trends, disparities, or patterns. When you're doing the research and your data collection, you kind of get so focused on gathering information, you kind of almost get lost in the numbers. But with the analysis, you kind of want to take a step back and look at the bigger picture. What is it actually talking about? So what are all these individual data points bringing together, and how are they actually connected? So one of the very helpful things that you can do is you can start kind of grouping your data together into meaningful categories. Within our paper, we grouped organizations together based on their budgets into budget classes, as we call them. And this allowed us to compare how funding was distributed across different sizes of organizations and to really highlight the disparities that might not have been obvious otherwise. You can kind of tailor your analysis to your specific research question. So, for example, you might be grouping data based on where funding is being spent. So, is it going towards treatment programs? Is it being allocated to policing or enforcement? Or let's say you're looking at geography. Where is the money actually going? Are there certain regions receiving specifically more funding than others? These kind of groupings can help broaden your scope and make the pattern stand out more clearly and help you to build a stronger, more focused story. So when getting into the analysis, Alexis started off by kind of performing a very basic spreadsheet analysis, which really simplified the data, calculating the averages across the different categories that we made. And that gave us a very initial, like high-level understanding of what's going on within our data. And it can be helpful for you to see whether there are any obvious trends or imbalances that are worth exploring further. Probably the most important factor when analyzing data is accuracy. This is extremely important when you are investigating larger systems or institutions. Every number matters. That means making sure your data is verified, double-checked, and even triple-checked. Because there were so many changes on the OASIS website, we had to check through our numbers multiple times to make sure that everything was correct. And then once you move into your statistical analysis and you begin showing that the relationships in your data are strongly correlated or significant, your findings can become much more powerful and much harder to ignore. But that accuracy is very important because these large organizations and systems, you may be ruffling some feathers, so people may try to pick your work apart. So you got to make sure that it is irrefutable. And then to back up our final analysis, we use some statistical analysis tools. Probably one of the most commonly used platforms is SPSS, which is a licensable program, but many universities provide access to it as well. However, we chose to use JASP, which is a completely free resource. It is very intuitive. and easy to use, especially if you are newer to statistical analysis. And within these platforms, you can generate descriptive statistics, so find the means and averages. But more importantly, you can run tests like t-tests, ANOVAs, or regressions, which allow you to move beyond just simply observing the patterns, but rather proving that these patterns are statistically meaningful. And this adds an extra layer of rigor to your work that helps transform your findings into evidence that is much more compelling and difficult to dispute. So the other half of data analysis is visualizing the data. So that is being able to clearly communicate your findings. A lot of people, especially those who aren't very familiar with statistical analysis, will look at a table full of numbers and feel completely overwhelmed. So like the last slide, just a bunch of numbers, don't really know what to do with them. So it's very important to think about your audience when you are presenting your data. And your goal is to really translate these complex results into something that is easy to understand and also visually engaging. You can create charts and graphs directly in tools like Excel or Google Sheets, and often statistical programs will generate them for you as well. But to really make your visuals stand out and be accessible, it's helpful to refine and beautify them. So for us, we use Canva, which allowed us to take our very basic charts and turn them into something much more polished and visually appealing. Canva gives you so much flexibility within design, and honestly, it makes the process a lot more fun and enjoyable. So when I was working on our visuals, I had made a bunch of charts just because it's fun. And then from there, we selected the ones that most clearly supported our main goal. And the process of iteration is also really important because not every chart will effectively communicate what you want it to do. There are also a lot of creative ways in order to visualize the data. So depending on what you're researching or trying to show, uh, you can change it. So for example, if you were looking at where funds are being distributed geographically, you may use something like a heat map to highlight the concentration across different regions. If you're comparing categories like organization size or spending type, you may use a bar chart. The key is just to match the visualization style to the story that your data is telling. And if you're not really familiar with any of these tools, that's totally fine. There are so many resources available online. These platforms are pretty easy to learn. Canva's a great one, very easy to find tutorials for. Lots of people love it, and I'm sure if you can find somebody who's willing to help you out. And also, if we have interest, we would love to host a webinar specifically on the data analysis and data visualizations techniques that we used here. So at this point, I'm going to give the floor over to Chelsea.
Thank you, Macy. So I'm going to talk a little bit about the actual construction of the report, the cobbling together of everything. For this step, we really started with a simple question. We asked, what does this research actually say this money should be used for? So when we say literature review, a peer-reviewed research, the jargon translation of that does not equate to summarizing articles. We're really asking what works and what should be getting funded and what is proven to work. So we looked at peer-reviewed research on overdose prevention. We looked at evidence on harm reduction. We looked at policy guidance on how opioid settlement funds are supposed to be used. And that gave us a baseline. So from there, we moved into the policy analysis. We compared what the evidence recommended with how New York actually spent the money in our own individual analysis. And what we found was that there was a pretty clear mismatch between evidence-based strategies and where funding is actually going. So this step really set up the rest of the report because it showed us this isn't just about funding levels, it's about an actual structural misalignment for funding distribution. Next slide, please. So then we moved into writing the report, which sounds very straightforward. And draft one, we definitely did think it was straightforward. By draft three, I think we can all agree that it was definitely not. It is a very dynamic process. So the issue here, the main kind of like heat for us was this was about not just like presenting the data. It was about making this data useful, using this research as a tool for advocacy, to take the words out of my own mouth, because we had to take all of this information and turn it into something that is clear, grounded in evidence, and actually usable. because if it's going to sit on a shelf, it's really going to be doing nothing for us. We've failed. So we were really intentional about several things. First, we were very intentional about keeping it clear, using plain language. We are writing for a broad stroke of people in community organizations, people in advocacy, policymakers, not just people situated at the ivory tower of academia. Second, we wanted to be direct about what the data is showing, not biased, but we weren't going to be pretending or feigning neutrality either. If communities were being underfunded, like the data says, we were going to be very frank about that. And three, we made sure that we used smart, actionable goals in our recommendations. We didn't use any broad statements like increased equity or things like that. We used concrete language like changing funding mechanisms, setting allocation thresholds, and improving transparency. Because the goal isn't to describe the problem, it's to support the change and the solution. Next slide, please. And this is the part of the process that was the most challenging, which is the data that we were using, particularly the data from the OASAS website that Ella had shown us previously, was not stable. It kept changing. It lives online in a cloud, and that cloud changes shape a lot during this process. We would pull the data, we would start analyzing it, and then we would go back later and we would see that numbers had been changed and updated, categories were changed, information was like added, information was removed. We weren't just analyzing the data anymore after like the first draft. By the third draft, we were really tracking the change of the data over time. So that meant that we were doing an additional evaluation, going back and rechecking the changes within our own data set, rerunning those analyses, and then making sure that we were always working on the most current version because that version changed quite a few times. And it really raised some additional concerns for us about transparency because when the data is changing without clear documentation or cause, it becomes really hard to replicate findings, track funding over time, or really fully understand what's happening. This significantly slowed us down, but it also really became an integral part of the story for us about how accessible and reliable this information is to the extent for people who are trying to make sense of it. Next slide, please. And then this is really the core of the report and what I enjoy the most as an early stage PhD student is grounding everything in theory and theoretical framework. So everything we did, the research, the analysis, the writing really leads to this, and that is community-based organizations are not being funded in proportion to the role that they play in this response. So to make sense of that, I pulled out the most popular, perhaps, framework in public health, the socio-ecological model, to map where different types of interventions sit. So you have at the top the policy and institutional, those would be like your OASAS and government entities would be there. Health system, health and hospitals would be up there. Further down, you have the individual level. And the benefit of community-based organizations and why they're so good at meeting people where they are is because they're in that same circle as the people receiving the services. And the model shows us that while funding is heavily concentrated at the top of the systems level, the most responsive and consistent administrations are really happening at the community level where both parties are situated. Those outcomes are really shaped by what's happening closest to the people, and then the underfunding that is going to limit impact, really no matter how much is invested elsewhere. So if our opioid settlement funds, regardless of where they're being spent, are meant to reduce harm, they need to reach the part of the system where the harm is actually being perpetuated every day. Because without that shift, we're continuing to invest in the outer layers of the system, and then we're basically perpetuating the entire epidemic. Pass it back to Ella now, next slide, who will go over and unpack a little bit more about the setbacks and challenges that we've foresaw.
Yes, thank you, Chelsea. And as Chelsea touched on a little bit previously, the Oasis Opioid Settlement Fund Tracker website was updated with no warning or explanation as we were in the middle of doing the research and data collection for this report. I remember I was just doing like a confirmation of our data to the tracker website, making sure we had our data right, that it matched the facts. And I looked at it and it was changed significantly. We originally had our report focused on the fiscal year of 2022 and 2023, but in this September 2025 update, there was a table for the 2022 fiscal year, but that was just erased. It's gone. We don't know where it went. And so we had to refocus our report to just FY 2023. So we could have a way to check or have our data be verifiable. But in addition to getting rid of the 2022 table, there was also they conglomerated a lot of the multi-year funds into just one link that was the same in each table for each year. So there was no way for us to know exactly what some of these organizations got funded in FY 2023. And so essentially there was a piece of our data was just gone. There was no way for us to check it again. And so we couldn't see half our, or not half our data, but a part of our data, and we had to adapt. And so that kind of brings us to what we wish we did differently. With this report, we wish we took screenshots of the Oasis Tracker website so we could look back and see our data that was there, but they got rid of. And as I said, that was one of our foils we submitted as soon as we saw that change took place. We were like, well, what happened? And so we submitted a FOIL to Oasis asking for the updates to the website, what was changed, and why. And another thing we wish we did differently was understand the flow of funds earlier. It took us a minute to just wrap our heads around this. Like I said before, there was kind of a few different names for some of the funding streams in New York State. So we thought we were looking at one, but really we were looking at a different one. And then once we got that flow chart down and saw exactly what we were looking at, we could kind of tailor our report better. Another thing is we wish we requested these foils sooner. As I said, I'm still waiting on 6 months later. So that information could have been used in our report, but they don't want to give us that information. And finally, we wish we could prepare and brace for these changes a little bit better ahead of time, because just knowing that anything could change, anything can happen is a good mindset to have going in, and that what you start with may not necessarily be what you end with, and that's okay. And now I think I'm going to pass it back to Alexis.
Awesome. Thank you. Yeah, Gretchen put in the chat that we have a great team. We do have a great team. We're so lucky. So the next step that I would recommend, I come from the engineering world where all of your work is peer reviewed. I'm a bridge engineer, and there's a reason for that, because you want your mistakes found. I tell people this all the time, like as an engineer, you want all of your mistakes found because you don't want the bridge to fall down. And so that's the same approach that we take to pretty much all of our work at Truth Farm. I think that having things reviewed by others is really important. And in the case of a report that you're going to publish where you're criticizing giant systems, as Ella mentioned earlier, it's really, really important to make sure that you've got it right, and that more than one person thinks you've got it right. And we are really lucky and blessed to have a lot of incredible comrades out here that we work with. And so I tapped into some friends and colleagues, and we got some heavy hitters. I'm not going to be afraid to say how proud I am and grateful to have so many impressive names who helped us. So Rob Kent, a lot of you might recognize, he was the New York State Oasis General Counsel. He's an attorney who reviewed our primer for us to make sure that we really got it right, because as Ella mentioned, there was you would think there would be one place to go to on a New York State website that would tell you exactly what the flow of funds was and who's in charge of it and how to make changes. that didn't exist. And so we had to pull information from a lot of different locations, and we created the primer, and Rob Kent reviewed that for us. And so we could rest assured that we got it right. And then our other reviewers, Tony Smith, New York State Policy Director with Drug Policy Alliance, provided incredible comments on the report, but she also titled the report. So a lot of people have commented and said that they like the title of our report. Tony gets the credit for that. We had not landed on a great title yet, and asked all of our reviewers if they'd like to suggest a title. And we loved Tony's title, and we used that one. And Christine Minhee, who is the creator of the opioid settlement tracker.com, and Tricia Christensen, who's an incredible consultant and an expert in opioid settlement funds, and Tracy Gardner, executive director of the National Black Harm Reduction Network, all reviewed the report for us and gave us incredible feedback, in which we incorporated. And I think that's a really important note to make. If you're going to ask people to spend their time providing a review for you, that you take their advice and incorporate their changes. So we incorporated all the changes that were suggested, and the feedback was so helpful to us. So that was a great process. The other benefit of having peer reviewers is now you have another, in our case, 5 people who were interested in promoting the report. You know, they worked on this, they were invested in the process. They've been really helpful and instrumental in getting the report out there. They've shared it. I've seen them share it on LinkedIn. They've talked about it when they're giving, they're on panels and talking about opioid settlement work in general. And so that's like an added benefit, that you have that many more champions out there supporting the work that you're going to create through your report. And just, we really were so grateful for our peer reviewers. Next slide. And then the next step kind of is publish, but before you publish, I highly recommend creating a plan to maximize the impact of the report's publishing. Again, we're really lucky on our board. We have a gentleman, Paul Fahey, who some of you might know, who is a part owner in a PR firm. And so we met with Paul. We also have a couple amazing volunteer writers with Truth Farm, Judy Mandel, who's a published author, and Sharmi Golson, who's well known for writing articles in the overdose epidemic. They're volunteer writers for Truth Farm. And so we got them together with Paul and our whole team. And Paul helped us create a plan for releasing the report and all the steps that we would go through. And then we issued a press release letting people know that the report would be coming out. We also connected with reporters that we've worked with in the past, and talked to them about the report and let them know that it was coming out. A couple of them, we gave them a preview of the report before it was published. And we collaborated with other organizations in a lot of different ways. So this really points to 2 different things. One, we have a lot of relationships nationwide. Truth Firm has a lot of relationships with other organizations, but here in New York State as well. But collaborating with other organizations could look like Friends of Recovery New York has been an incredible, just friendly organization in the releasing of the report. They've had us come twice to their meetings to present on the report. And so other organizations, Legal Action Center is another one, who invited us to co-present with them on the report. So collaborating with other organizations is another way to get the word out. And we think that that's really important. And then the last thing would be, and then publish. And then the next thing is going back to what started it all in the first place. So we already had in mind using this report as an advocacy tool. But you're going to want to organize with others who care about the same thing. So we are collaborating with a bunch of other community-based organizations and grassroots organizations in New York State, those who have budgets under $5 million. So they were in a specific category within the report. They're the least resourced organizations generally, and they were the least supported by opioid settlement funds. And so we're organizing with them to do the advocacy to make a change. We also attend all the opioid settlement advisory board meetings. We had already been doing that, but we emailed our opioid settlement advisory board the report ahead of time. But then we also showed up at the meeting and we handed out copies to all of the board members and to attendees as well. And that really made quite a splash. The board members, a lot of them clearly had not seen the report before the meeting. And so a lot of them were like, looking through the report during the meeting. We also had a moment that was kind of a favorite for a lot of us is Chelsea had gotten a legislator to show up at the board meeting, which is the first time that's happened. And I don't have my report with me, but this is what he did. He stood at the podium and he shook the report in front of people. And he was like, I read this, and this is an embarrassment to New York State. So, the report itself can serve as such a powerful tool for advocacy. I mentioned we co-presented with Legal Action Center a webinar on opioid settlement funds in New York State. And those amendments that I mentioned that we were trying to get some traction with last year that we got no traction with, all of a sudden now we have half a dozen legislators who are ready to carry the legislation to get those amendments enacted. And that literally is all because of the report. And meet with your legislators and talk to them about the report. We emailed the report to every single legislator in New York State, but we also know that legislators probably aren't going to sit down and read a 38-page report. And so it's important to create like a digestible format, maybe just a two-sided single piece of paper. On one side, it might highlight the findings. I would encourage you to pick the most egregious things from the report. On one side, highlighting the findings, and then on the other side, providing your recommendations for what you want to see changed. A lot of times legislators get frustrated with people just pointing out what they don't like and without giving solutions. And so we were very specific about providing, we know exactly what we want from our legislators, and we showed them that. There was one other thought I had, but I think I forgot it. One thing that we also did, and for us, it worked out great. For you, I guess you have to play with it and decide what you want to do. But Chelsea and I went to Albany the week before the report was released. And we focused on, Ella scheduled all the meetings. We focused on meeting with legislators who were already concerned with opioid settlement funds or who were involved with the drug and alcohol committees. And we met with them beforehand to give them a preview of the report. We took a draft copy with us. We offered to share an electronic draft copy with them as kind of a courtesy. We also did that with the major agencies in New York State. We offered that to OASIS to meet with us initially. They declined. And also the Department of Health and our governor, who also declined. But we gave them that courtesy of seeing the report before it came out. And I think in terms of advocacy, that was one of our most powerful tools, was meeting with our legislators before the report came out. Next slide. And that's it. We wanted to make sure that we left room for questions, and we did a good job at that. There's a link there to the how-to guide, so how to write your own report. There's also a link to an advocacy form. So if you're in New York State and you're interested in participating in the advocacy, we would love to have you. We need more people who want to make these changes happen. My contact information is there. I think I mentioned, maybe I didn't, but I'm involved in a national coalition who originally started out, our concern was supplementation of funds. But now the concern and the issues around opioid settlement funds within our group is growing. We're welcoming anyone who would like to participate in that national coalition. It's very organically growing. I think there's maybe 8 of us so far, but if anybody's interested in participating, just reach out to me and I'll connect you with that group. And there is stuff going on with the Purdue Pharma bankruptcy and criminal charges. And next week we will be having a rally in Newark. So if anybody's interested in participating in that, I saw that Susan Osterman is on the webinar as an attendee. I would encourage you to find her on social media or reach out to her so that you can see what she's written about that and become involved if you can. And I am going to now open it up to questions, which I think you can put in the questions thing or just in the chat. Either is fine for us. And so let me see if there's anything here so far. Somebody put a community town hall for Rome, New York in there, so that's great. I'm hoping that that's maybe touching base with your community. Robert, do you want to say more in the chat about what that is? And any other questions anyone has? More about the rally in Newark. The proceedings start at 2 p.m. We have not set a time for the rally as of yet. Some people will have an opportunity to speak in the court proceedings if they get a statement in soon enough and request and are invited to speak in the hearing. So my guess is we'll probably want to gather at noon or 1 p.m. But Susan and I need to get our heads together and plan the rally out. But I would imagine we'll gather around noon or 1 p.m. And Susan, if she's still here, could put the address at the very least, because I know that we're gonna at least gather there, and we will figure out the format as we go. Are you planning to legislate your recommendations? Yes. Legal Action Center is currently working on the language for us for the legislation. And we were really hoping to get this legislation on the books this year and get it passed this year. Of course, every week that goes by, I'm stressed that we won't be able to do that, but I'm hoping to see the legislation from Legal Action Center any day now. And we have legislators who, like I said, we have, I think, 3 on each side, Senate and Assembly, who are interested in carrying the legislation. So we have backups to our backups. And there's the address for the rally. And Susan, maybe you can put in the chat just for other folks, if you agree, if 12 or 1 is probably about the right time to gather for a rally. And if anybody's looking at things noon, okay, noon it is. If anyone is seeing anything in your area that you've been interested in exploring, I mean, you could put that in the chat as well. Tricia says in the chat, just a comment to share, note that in some states, you can affect change even without legislation. That's very true. Sometimes it's just an internal policy change by the opioid focused council, et cetera. So don't be shy to speak up. I totally agree with that. We've had incredible impact on our New York State Opioid Settlement Advisory Board. Actually, Ella, could you stop sharing those slides, and then I think we'll be bigger squares. I wish we could see people. But if you have an advisory board in your state or county, show up to those meetings. Like we've impacted change within our board itself. So you can definitely do that. And we also feel that the changes that we want, Oasis could do themselves. The making sure that there's an equitable distribution for funding could happen just at the New York State level. They don't need legislation to do that. Chelsea and I and another grassroots organization member went and met with Oasis to tell them what we meant by that and to give them examples of equitable distribution spending models. We also met with New York State Department of Health to do the exact same thing. Oasis literally was not interested. The email I got back was, we've informed leadership of your concerns and the advisement you provided, period, nothing else. And so there is a chance, there was a chance that meeting with Oasis would be like, hey, we see what you're saying, and we don't think you're asking for anything unreasonable. Like, we weren't saying put all the money at the grassroots level. We were like, change the distribution so that there's a more fair distribution. And they just were not interested, but they could have made that change themselves. And we have to check back in with the New York State Department of Health to see if they are going to take any of our recommendations. But if you don't get a change with an agency, I do think it's important to try with the agencies. We tried. If you don't get a change with the agencies, then advocate. And if you don't get any success with advocating, be activists. That's the path that they all turn us into activists. You just got to take whatever path it is to force the change that you need. Yeah. And if there are no other questions, okay, so Robert put, that's great. So the theme is opioid settlement dollars from allocation to action. That's wonderful in Rome, New York. So if anybody is near Rome, New York, I would highly encourage you to go to that. That sounds really great. Thanks, Tim. We appreciate it. That sounds like a really great town hall. So that's June 25th, 6 to 8 p.m. in Rome, New York. And I imagine you could reach out. Yeah, we'll put the recording probably on YouTube, and we did talk about getting an email out to everyone with all the links that we shared so that people can look at things later. And we're happy to help in any way that we can. The more people who are holding their feet to the fire and doing this exploratory work in your area, the better. So thank you. Thank you all. And we probably can close. We're just getting thank yous, so. All right, awesome. Good job, everybody. I'm going to close it out.